Today we are introducing a report that we produced, which is called Supporting Youth Living with and Affected by HIV in Ontario. So YouthREX worked in consultation with the Teresa Group on this research practice report. The report is part of YouthREX's Moving the Dial on Youth Wellbeing series. It aims to selectively synthesize and translate practice-relevant research for youth sector stakeholders in Ontario. The report was released last week. As we said, it's already available on our website. We encourage you to give it a look if you haven't already. The format we'll be taking today is that we'll introduce you to our speakers and panelists as we move forward. So next slide, please. So you can see some of the speakers that we have over there. First of all, we'll give you a quick overview of the report. We'll give you an overview of the context for HIV in Ontario. We'll point out that this is by no means a conclusive summary of what HIV work looks like in Ontario. Throughout the report, we have linked to other organizations who are doing really impactful and meaningful work in this sector, and we'd encourage you to visit the resources section that we have in the report and to also learn about other organizations and what they're doing around HIV work in Ontario. Next slide, please. So before we introduce Ilhan Abdullahi, who is the report writer, we'll give you a quick overview of what HIV in Ontario looks like. So in 2016, there were 881 people who were diagnosed with HIV in Ontario. HIV in Ontario cuts across race, sex, gender, it cuts across all demographics, and we also know that young people are affected and impacted by HIV. In 2016, in Ontario, 235 young people between the ages of 15 and 29 were diagnosed. One thing that we know that we've noted in Canada is that the number of new diagnoses amongst youth has increased by 13% from 2012 to 2016. So this is something that youth sector workers are paying attention to the increasing numbers of young people who are impacted by HIV. We also know that the HIV epidemic in Ontario is concentrated in priority populations. So meaning that we know that there are some populations who are disproportionately impacted by HIV. Of note, we know that gay, bisexual, and other men who have sex with men, Black folks, Indigenous folks, people who inject drugs, and women who are at risk, in particular trans women, tend to be disproportionately impacted by HIV. We'll now be moving on to the report itself. At this time, I'd like to introduce Ilhan Abdullahi, who is the lead author for the report. Ilhan is a research associate at YouthREX. She's also completing her Masters of Public Health at the University of Toronto Dalai Lama School of Public Health. Thank you, Ilhan. We'll hand the mic over.
Thank you. Hello, everybody. Thank you so much for greatly contextualizing what we'll be talking about today. So as Sani mentioned, the report highlights the need for specialized interventions that address the multiple broader structural and intersecting social determinants of health. So we're looking at more of the macro level things that further perpetuate HIV prevalence in addition to preventing youth from accessing these services. So I kind of synthesized the literature, and as Sani said, there's a plethora of amazing things that are happening out there, but I try my best to kind of pull from different resources, community resources, different individuals, and try to really synthesize the information to create the best recommendations, or at least the top 9 recommendations that we could put forward in working with youth. Next slide. Thank you. Okay, so in terms of really synthesizing the data, the one thing that we had to start with is thinking about what are the key theoretical approaches that could be used and really integrated into supporting youth. So in understanding what are the barriers and why do these barriers continue to facilitate? And thinking about it, the 3 main perspectives we looked at was intersectionality, looking at anti-oppressive approach and practices, in addition to anti-stigma. So I'll kind of go into it a little bit in depth to kind of help break it down. So with intersectionality, this was a term that was first coined by Kimberly Crenshaw in trying to understand the issues faced by racialized women, Black women in particular in the States. And throughout time, this has really been integrated in a lot of critical race theories and different ways of understanding youth work and the perplexities of different public health interventions. So again, it's an essential framework that really addresses the social determinants of health, the structural factors and experiences of young people. And it's really thinking about this idea of control, and it surpasses the individual's control. These are stemming from structural inequities that are within policies, that are within structural factors. And we really need to take this approach in trying to understand how we could best support young people living with and affected by HIV. So in order to do this, we really need to critically assess and address the macro level factors that are, again, beyond the individual's control. So we're thinking about the social, political, environmental, and even personal factors that at times can perpetuate stigma, discrimination, and facilitate these barriers to support services. So the second one is looking at anti-oppressive practice, and what really this means is that we're centering the lived experiences of the young people themselves. It's taking a more strength-based approach and really critically examining the power imbalances that exist. And again, centering the experiences of most often marginalized and vulnerable youth that don't have their voices amplified enough in policies and programming. So when looking at this, we're simultaneously addressing the systemic barriers that exist to certain health and social services. And again, back to acknowledging the lived experience. This is really integral in providing support services and understanding why there might be a lot of barriers. As Sandy mentioned earlier, since 2013, the prevalence and incidence of HIV among youth has increased. And what we're seeing with that and what the research is showing is additionally, what you see is a decrease in the usage of systemic services, social services, and other support services that exist for youth. And the last one is looking at anti-stigma, and what this approach entails is really being mindful of the stereotypes, the microaggressions, in addition to the discrimination that's experienced by young people, and really validating their experiences. So not just knowing that it exists, but when the individual's connecting with you, really validating their experiences of facing discrimination by the healthcare system or even their social workers, peers, and family members that, again, really go into that cycle of why they're not accessing services. Next slide, please, as I sip my water. Thank you. Okay, so just to quickly summarize, some of the key findings that I found from doing a literature search from organizations within Ontario, within Canada, and looking at more macro level in terms of the global scale, what I found was that programs and support systems that really implemented group therapy models, so looking at play therapy, taking a strength-based approach, in addition to age-specific programming, which in itself kind of fosters that sense of relatability and connections with individuals of the same age group. Ones that included peers and community leaders, included parents and other support systems in youth lives. In addition to peer lead mentors, we're seen to improve access to support services among young people living with HIV. And additionally, what the research entailed is that programs that were able to foster mutual and supportive relationships, so not just looking at that supportive aspect from yourself as a frontline worker, as a staff, as a policymaker, but again, that mutual piece. So really shifting and restoring the power to the young people themselves. And that spaces that were able to facilitate open dialogue that aim to reduce stigma and discrimination and promote inclusiveness were all seen to really decrease those barriers, and really facilitate and foster that trust between service providers and young people living with and affected with HIV. Next slide. So what were some of the best practices that we're able to kind of find and synthesize in this report? One of the things is really understanding youth's lived experiences. This is what most often in the research you didn't find a lot in terms of policies. So how could we integrate their experiences of stigma, of discrimination, of not being able to find services that they could fully trust? And how can we think about this in terms of their strength? And this also really important component of this is thinking about health literacy. So most often the way that we are disseminating and providing information to youth, is it accessible in itself? Is the language being used accessible? How can we center their experiences and incorporate that into health literacy and to facilitate that dialogue and support system for youth? The second one was looking at creating leadership roles and opportunities. And again, this is really looking at integrating the intersectional lens that we talked about earlier, anti-oppressive approach and anti-stigma, and really putting youth's voice and amplifying their voices in the forefront. Ways that this could be done is to train youth to lead workshops, to have them actually be in the front line, developing the programs, thinking about the logic models and where the directions of the conversation and programming is really going. And again, it's based on centering their experiences and creating these roles for them and with them. The other one is prioritizing youth voice, again, centering their narrative, amplifying their experiences, and then positioning them at the forefront of telling us as service providers what are the challenges and what are their needs, and thinking about it from, again, that strength-based approach. The other one is thinking about removing barriers to services and programming. So as yourself, whether you are in the policy end of things, working directly with youth, and facilitating these programmings, what are some ways that you can, in yourself, in your position of power, remove barriers to services and programming? So for this, it's thinking about the hours of programming. Is it feasible? Does it work with the youth in terms of confidentiality, ensuring that things like you don't out the youth, for example, and say that this is a group meeting with youth living with HIV, trying to refrain from doing things like that, thinking about the location where these are being hosted, transportation costs. Is that going to facilitate even further burden for individuals to come and access these services? And thinking about cost of programmings as well. Having these kind of dialogues before the programming is implemented and really having youth be involved with that process is really critical. The other one is providing a safe, oh, next slide, sorry. Perfect. The other one is looking at providing holistic support. So for this is thinking about collaborative partnerships and creating that seamless transition in the referral process. So incorporating other services such as mental health services, wellness groups, what are other ways that you could kind of facilitate a sense of community and trust and really seamlessly transition youth and young people living with HIV to really be involved in those spaces. And also thinking about services at the individual level, not just within group workshops that are strength-based, but how could you promote and build rapport with the individual and think about services that you could provide at the individual level in itself. And this also goes hand in hand with providing a safe and supportive environment. Again, with that, you want to think about mutual and supportive relationships that go both ways, not just from that authoritative and paternalistic approach, but really thinking about in this two-way relationship, what can the young people really bring in that we're not able to capture holistically. And then we also have providing anti-oppressive training for frontline staff. Again, it's individuals that are in these positions that can really change the narrative and create that safe and supportive environment that takes a holistic approach. Ways in doing this as an organization could be to think about training opportunities and ensure that they exist and provide them for youth workers. And with these trainings, to really think about the social determinants of health when you're working and providing care to youth that are living with and affected by HIV. And being mindful of language, that's a really important piece. So the terminology that we use when we're working with young people, instead of things, for example, as this individual's HIV infected, framing the language to be, this is a young person living with HIV, or even better yet, connecting with the young people themselves and asking them, what is terminology that you feel most comfortable with that we could use that can definitely approach and tackle, stigma and discrimination that they potentially and do face. Yeah, so I think that's it in conclusion of the best practices and a summary of my findings from the report, and I'd be more than happy to answer questions later on. Thank you.
Thank you so much, Ilhan.
Yes, I can mute now and.
Thank you so much, Ilhan. That was great. What a succinct summary. I'm sure lots of you are thinking about many of the things that Ilhan has said. I took some notes myself while she was talking. So thank you for covering the breadth of this issue, looking at issues that we can think about from the macro level right down to what does it actually look like when you're working with a person every day and trying to treat people in a way that recognizes their humanity, but also does not minimize them to one thing. Thank you very much for that, Ilhan. I will also point out what Ilhan has provided, what she's outlined, the best practices and the best types of program features are available in your handout section. We pulled them out as tearaways from the report, so you can just have that as a one-pager, which would be those 7 program supports or those 8 best practices So please feel free to download those. One thing we are very excited about today with the webinar is being able to have a discussion. So to talk to various people that we have today, I would now like to introduce Ashley Murphy. It's very exciting for us to have Ashley here with us today. Ashley is an activist and a youth advocate who herself is living with HIV. She's done a lot of organizing work around HIV supports for young people, both here in Canada and in other parts of the world. For example, she's traveled to Kenya. She's done some really passionate advocacy work, and we're very excited to have Ashley with us here today. Welcome, Ashley.
Hello, thank you for having me here today.
Hey, Ashley, I'll just ask you to turn on your webcam.
Yes, okay.
Yeah.
Okay, there we go. I thought it was already.
And the question we have for you, Ashley, we thought maybe you could start by, can you tell us a little bit about your experience as a young person living with HIV in Ontario? Where did you access services, and what did good support services look and feel like for you?
Well, just to begin, I was born with HIV. So I've had it for 20, almost 21 years now. And it all started with, from the ages of up until a few months ago, I went to Sick Kids in downtown Toronto, and that's where I accessed most of my services. Those were where my healthcare providers were at. I've known them since before I knew my adoptive parents when I was 6 months old. I've been in their care since I was about 6 weeks old. Mm-hmm. So I've really gained a history with them. Mm-hmm. And I feel like that has been a very crucial part of not only my learning, but my growing and really understanding what it means to be an HIV positive youth living in Ontario and what that looks like and how you can access other services. So through Sick Kids, I was able to get involved with the Teresa group, and I've been going to support groups ever since I was very little. I think probably up to 7, 8 years old. And I found that they really help, and they help facilitate a conversation that you wouldn't have otherwise. And it really helped me just because it helped me find myself, I find. Mm-hmm. Because I first learned that I was HIV positive when I was 7. My adoptive parents, they sat me down and they told me what it was. And I was just kind of okay, cool. I didn't really know what it was or what it looked like for me, what I was going to be experiencing. I just kind of knew that I went to a lot of doctor's appointments and that was about it. And I took a lot of medication for what I now knew was a virus called HIV. Mm-hmm. And then once I actually started learning about it and started going to these support groups, I realized that I wasn't the only one. And I feel like that is such an important thing because a lot of these youth, when they come to these support groups for the very first time, they're very nervous because mm-hmm. they don't know what to expect. They don't know who's going to be there. They don't know anybody. And it gives you a sense that you're only in this by yourself. Mm-hmm. And when you go to these groups, you actually realize how important they are and how much they really can help you. Mm-hmm. And so not only being a part of the youth group at the hospital growing up, but being a part of the Teresa groups and going to downtown Toronto every Saturday, where I always knew that there's going to be bagels there and juice and just some really great conversations. Mm-hmm. Because the whole focus isn't primarily on just HIV. It's just about us as youth. And I think that's very important because talking about HIV all the time can be draining. And sometimes we just don't want to talk about it. We don't find that it really helps us. It's just kind of it's just kind of a reminder. Yes, we do like talking about the issues and what we're going through, but a lot of times it's nice to go to these support groups where you know these people and you can just be a kid for 2 or 3 hours, which is really nice, not to just realize that yes, we are here because we have HIV and we're born with it, but we're also here because we're kids and we want to get through it together. And I find having that support group is probably one of the reasons why I do what I do today, mm-hmm. just because it really helped facilitate my learning and my growth as an individual with HIV and what that looked like and how I was going to carry on with my future. And knowing that I had the support of other people, that really goes a long way.
Mm-hmm. So actually, you've done a lot of work like around advocacy for youth living with HIV. How have you been supported in doing that, even as you travel? Have you worked with organizations who've helped you develop that portfolio, or is it really something that you've led yourself?
Well, I started speaking at the age of 10, just doing small little conferences and whatnot with actually some of my friends from the Teresa group and from Sick Kids. Like sometimes doctors would ask us, would you like to be a part of this? Your name and your photos and all that stuff that won't be going online. It's just something intimate, just so we can learn a bit more about the virus and how youth are dealing with it.
Mm-hmm.
And so I started doing that at age 10 with some of my friends growing up, which was very nice. It was very chill just because it was just us talking and us sharing stories and just telling people who we were and our experiences. And then from then on, it just kind of, like for me personally, I was one of the few youth that actually continued speaking, just because I, like a lot of it has to do with shame and the stigma surrounding it. Because like a lot of these youth, they keep it in their hometowns, they keep it very private. They don't tell anybody. But for me, that wasn't the case. I told so many people at my elementary school when I first found out. I didn't know too much about it. And so just telling a group of like 500 doctors was it was so easy for me. It was a walk in the park. And having my other friends by my side, because I was one of the younger ones at that time, it was really beneficial to know that I had the support of my friends.
Thank you, Ashley. I think that's you've highlighted something that's very important, that shame and stigma, and that it's very hard sometimes for people to speak openly with HIV, just because shame and stigma is still very real.
And everyone has their different experiences. I know that some friends that I grew up with, their parents wouldn't let them say anything, just because of like the shame and stigma. And even when I was told as a 7-year-old, when my parents sat me down, they told me, they were just like, don't tell anybody, because they were scared that I was going to get bullied, which was, a normal parental reaction, because they just want to make sure that their children are safe and healthy and taken care of. But for me, I didn't think it was very fair, just because my parents had always taught my siblings and I to never tell a lie. And in that sense, I kind of felt like I was, because I thought I was hiding something very big. And HIV, depending on how you look at it, it could be this really big thing, or it can be very small. Like for me, I just think of myself, I am a 20-year-old individual who happens to have been born with HIV. I don't let it control my life. Like for me, like when I was younger, it was a lot more difficult with like medications and treatment and not being as well as I am. But now being healthy and undetectable, it's a lot more easy to share my story and to know that I'd like to say I'm more like the success, just because I'm one of the examples of how you can live HIV, how you can live life with HIV and be perfectly normal, whatever like normal is.
Thank you, Ashley. All right. I'm going to now bring in our other panelists. I forgot to say this earlier, but folks, if you have a question, please type it into the chat box, and we will take those questions after we've spoken to our panelists. So thanks again, Ashley. Stay on the line. I will now also bring in Samara Carroll. Samara is the family support team lead at the Teresa Group. I'll also bring in Dr. Sian Al Wilson, who is an assistant professor at Wilfrid Laurier University. Sian also lead research on HIV in Black and Indigenous communities in Canada. I'll bring in Kiana Graham and Dane Record, both of whom are at the AIDS Committee of Durham region. Kiana is the Youth Outreach Coordinator, and Dane coordinates the African and Caribbean Outreach Program. Hello, everyone.
Hi.
All right. So first of all, I thought, could you tell us all how you come to this work and what's informed your practice? Maybe we'll start with you, Samara.
Oh, can't hear you.
We can hear you now?
Can you hear me now?
Yep.
We can.
Okay, cool. So yeah, I mean, it's really nice to talk after Ashley because I've been at the Teresa Group for 4 years, and I came on as one of the Leading the Way facilitators, although I don't think we worked together, Ashley, at that point, but we've worked together sort of ever since. So yeah, definitely. I mean, I had worked in the past with different communities and came across the Teresa Group But I would say that it's everything Ashley was saying, but once you do, once you're involved in a process of youth and you see them providing peer support to one another, you know, it's really a meaningful experience. And then ever since, I've just tried to be there to facilitate more of these support networks and more opportunities. I think we started off pretty small. We had only a few youth coming to groups. We're trying to do more because clearly the peer support and, you know, just seeing one another is so important. But there's lots of barriers, which I think we'll talk about at some point. But that's sort of how I came to the work.
Mm-hmm. Okay, thank you, Samara. Dane and Kana, did you want to take on from there?
Oh, me first? Okay. Hello. I kind of got into this work by really finally seeing one of Dane's posters at my college. So I got into this work because I was just a youth trying to access services, and it was a group for racialized, queer, and trans people. And there was no group like that in Durham from my knowledge, and I was just like kind of coming into my own going to college. So I kind of got into that work that way, and I was Dane's student, and it kind of made me realize I really wanted to work with youth, and specifically racialized youth, because I feel like there's not enough for them here. So yeah, I kind of came here to build something before I move on.
For myself, how did I come into this work? As a volunteer coming in, it was an opportunity to hand out condoms, talk about sex, and curse a lot, and be able to keep reporting for the next day. Having the privilege, I guess, to be paid now to do all of that work, it's a lot of fun. Certainly being able, just in the role and in the work, to work with so many great people, just locally and in the province. I think it's really indicative of just the overall work that we do in this sector, in an AIDS servicing sector, outside of Toronto especially, that we're working with young people living with HIV, and it's young people working with young people, at least from the side of Durham region. We're based in Oshawa, so being able to do that and be part of a team that not only walks the talk, but also connects at a level that is entirely eye level. It's just a great opportunity and great privilege to be a part of. So,
Thank you. Before maybe we go to you, San, I'll also note that one of the things we really believe at YouthREX is that the lives of the youth themselves and the folks who work in the sector are the evidence. So it's really great to hear from you, Dane and Kiana, as you come, how you came into the work as well, because that's something that we should recognize, that the lived experience also is evidence. And we learn so much from the ways that people enter the work. Okay.
Absolutely. Thanks for that, Sana. I think that's a really good point, in the sense that, you know, our testimonies are enough. You know, that's enough evidence of a lot of things. And I think that often, you know, I think research, which is where I come from in this conversation, the perspective that I come from often misses that testimony is enough. So just a little bit about me, Cian Wilson, as Sana, I think, introduced. I'm based at Laurier University as an assistant professor. How I come to this work, I've been here in this sector for over a decade. I can't believe I'm saying that. I was a youth when I joined this work, and you know, was doing this work early on, and so it's sort of baffling for me how a decade passed by so quickly. And I came to this work really from the perspective as a Black woman, and knowing the statistics that we do about HIV and you know, Ilhan talked earlier about you know, intersectionality and what communities are impacted disproportionately by HIV. For me, it was also a point of sort of you know, joining a larger conversation about health inequity and disparity, about anti-Black racism, about colonialism, about all of these things that impact Black and Indigenous communities that leave us susceptible to HIV, in a really particular way. And so for me, HIV, as Ashley was just mentioning, we always focus on HIV as if it's this thing that operates in isolation, but it is this larger contextualized disease, that these things that, HIV transmission it doesn't operate by itself. It is a vector, a result of colonialism, all of these different things. So really thinking about that for me is really what a lot of my work has really focused on. So from my very first project, the Let's Talk About Sex project in, 2010 to Beyond the Colonial Divide project, where I was working with Indigenous and Black young people, to my work even now with youth, in terms of really framing HIV as not this disease singularly that operates in isolation, but that it is the result of colonial forces. The reason that it impacts the communities that it does, it's based in conversations around intersectional oppression. And so that for me is really the point in which I enter these conversations, and also for me, when I'm working in my own community, as well as the communities that I marginalized communities that I do work with, that's the lens that I see on the ground is really what frames what's going on, yeah.
Mhm. Thank you. That's great. Okay, so maybe Samara, Dane, and Kiana, a question for you folks. Seeing as you're at the front lines, what barriers do organizations face in meeting some of the best practices that have been outlined in this report? What barriers do you see in your work?
I think the first barrier is just really understanding who we're working with and who we're working alongside with. For myself, there's an understanding of who I work for, but really that work isn't happening unless I know who I'm working with and alongside with. So knowing that if we're talking about youth and HIV, we need to remember first that we're talking about working with and essentially connecting with young people. Being as such, we need to, and I learned this very early for myself, I need to be able to have young people alongside to have those conversations and to make those connections. I know early on that was a barrier for myself. Even early on when I started, I did start as a youth in this work, but coming along and just with the varying experiences that I had for myself, I was able to recognize early that I am no longer a young person. We need new leaders, new young leaders to come forward. So recognizing that and being sure that we meaningfully include the input, the voices, and the leadership of young leaders. Like I always defer and connect with Kiana because without Kiana's work and without Kiana's leadership, the work in Durham region really isn't flying if we weren't meeting young people with young people.
Great. Samara, do you have any thoughts on barriers to meeting some of the best practices that are outlined in the report?
Yeah, I mean, I think that what Ashley spoke about, the shame, is something that we see with some of the youth who come to Teresa Group or want to access their programs, that there is a fear about being, someone finding out, oh, you go to a program with people living with HIV. And I think that's something, that's a systemic issue we have to figure out how to address. And some of the things that Ilhan spoke about are things we're really trying to address, like not calling a group for people with HIV, but just having a youth support group led by youth, right? Or figuring out ways that we can structure programming to be in spaces that aren't clinical, that aren't medicalized, just spaces where there's food and music and people hanging out, right? And I think it is, like Ashley spoke to this too, it's hard for people sometimes to come the first time to the first group, but if they do and if they feel, okay, this is a place that actually gets me and gets, what's going on, it's other people I can relate to, people will want to come back. I think everyone's looking for support, but it's about setting it up so it's not the stigmatized, very serious space. So I think that's something to definitely draw from. Yeah.
Sian, do you see barriers in your work?
Yeah, no, definitely. I should also say that I sit on the chair. I'm the board chair. Sorry, I don't sit on the chair. I'm the board chair of the AIDS committee of Cambridge, Kitchener, Waterloo, and area. And so I do see it from two perspectives, both as a board member and as someone who's doing research, often in partnership with AIDS service organizations. And some of the things that I think organizations are juggling, or AIDS service organizations specifically, is one. I have to contextualize it with this history, which is that these organizations come out of activism, right? They're formed out of activism. They come to being out of activism in the 80s and 90s of folks who were impacted by HIV. And so if you think about that from the very, very start, moving from an activist space and an activist energy to this really professionalized space, that's a huge transition in terms of professionalization, in terms of the bureaucracy that an organization needs to be in order to receive funds and handle funds and all of these things, and not to mention all of the community politics. So no matter what AIDS service organization or is near you, there's usually this long history of politics, community politics often. And certainly the organization on which I sit, the board on which I sit is no exception, right? And so really thinking about that history for me, and where we are now in 2019, where these organizations are highly bureaucratized spaces that are also grossly under-resourced, right? In terms of human resources, in terms of funding, but constantly always having to push that envelope of wanting to take the activist spirit of its staff and the long-term staff that have been there for many, many years, and that energy, and also of people who are impacted by HIV, along with the bureaucracy. So juggling those things, for example, juggling funding and the lack of human resources is a big one that I definitely see on the ground. I also see sometimes priorities. So for example, in working in the Black community and knowing very well the sort of makeup of the sort of gentrification processes that are going on in Toronto and other cities like Ottawa and Montreal, for me, it's a big question of, okay, where are the AIDS service organizations in predominantly racialized communities, Black and Indigenous communities? Like where are those organizations? And so for me, it's asking that question of where are these institutions placed, and why is there a resistance to actually go to the communities in which they should and ought to be serving in a lot of ways. So I think about all of these different layers of what's going on with organizations. I think about the different ways in which, there's lateral violence in our communities. There's also a lot of gatekeeping in our communities, in AIDS service organizations and organizations that cater to, people living with HIV/AIDS and youth living with HIV/AIDS, which bar young people from accessing services, especially if you imagine the intersections, as Ilhan had spoken about before. You're queer, you're using substances, you're, all of those things, the homophobia, a lot of stigma towards substance use, all of these things layer, right? And in addition to being racialized, how these things can bar access because of the lateral violence. Again, with those organizations becoming professional spaces, there's also been this transition of who should be in those spaces, or what kind of PHA or person living with HIV/AIDS is allowed in those spaces. And those are all layers and tiers of barriers for young people, especially if they don't feel safe, as again, the presentation highlighted, if they're not safe and welcoming spaces for all different kinds of folks coming from all different walks of life. And those are the real things that I see on the ground in terms of barriers.
Thank you. Yeah, you've identified some really important gaps there. Are there other gaps that folks see that they would like to add to the conversation?
Yeah. So kind of adding on to the whole bureaucracy thing, there's less people doing the work than we think that has the power to make big waves. And at least here, I always have this thought in the back of the head of like, each of us run our programs, like our entire programs, and it's one person. And I always think like, if one of us is out of commission for a while, like what happens to the people we're serving? So definitely lack of funds. There's only so much that we can pull from, and making a good enough case to get it. And sort of talking about what Ashley said is that I think we need more just like wellness groups where Like maybe I don't want to go to like a Black group that they're going to talk about like all the racism we endure during the day. Maybe I just want to like hang out and watch movies and other things, and that's just as valuable as having a giant discussion about like some community issue. Sometimes people really just need to heal and relax.
Mm-hmm. Thank you, Kiana. Mm-hmm. Does anyone else want to add anything to that? No? Okay, all right, so maybe I'll move on to my next question then, which would be, actually you talked a little bit about this, but maybe I'll invite the other panelists now to speak on this. How does stigma affect the young people that you see in your practice? How does it affect them accessing services, and even just how they are as they come to these organizations? So I'll open that to the floor. Yeah.
Okay, I'll go.
Okay.
There was if I look at or think back to even 5 years ago. 5 years ago, doing this work, being involved in this work, whether as paid staff or a volunteer, the understanding or the perceived understanding was you're a young person coming into an AIDS service organization at a location that, while it may not be labeled as such, it is known that people living with HIV do come to these spaces. The assumption will be that you are a young person who is also HIV positive. Anyone else coming into the spaces will also be assumed to be HIV positive. The matter ultimately is we're still coming in to participate as we are, however we want to serve in our communities, whether it's young people living with HIV, whether it's caregivers, parents, even service providers coming in. That assumption years ago of, well, you're going to be walking in and people are going to see and assume really shouldn't be so much of the case anymore. It should be more of we're here to serve. I'm here to serve as a teammate in the community. Young people coming into the spaces are coming as they are, at least from my lens, coming as they are, whether to seek solace, assistance, leadership. It's a different look now, and I think just for myself, part of that comes from just saying that, you know, we don't need to accept the status quo of prior. We don't need to accept what was perceived and believed earlier. We're just here to come and do what it is that we want to do, and then we'll do what we need to do so we can thrive as a community, as a greater community.
Mm-hmm. Mm-hmm. Samara, I see you nodding your head. Do you have things you'd like to add to that?
No, I mean, I definitely think that's what we're seeing also. We work with families, so we work with youth and children, but also parents. And I think we've been noticing there's a divide between the stigma that many of the parents living with HIV are facing compared to their children. So what we're finding is when we're at Sick Kids Hospital or at other community agencies, we'll meet youth living with HIV, and they're like, oh, I'd love to come to your Leading the Way group, like our support group, and we have a camp, we have different programs, and people are into it. And then what happens is often they'll say, but I don't know if my parents will let me go also. And I think the stigma, it's complicated to navigate in a family, especially when youth are under 18 and they're living at home. And people are living all over Toronto, right? And it's not always easy to get to our office. And we do find that there's a bit of a divide generationally. So there's parents who are like, well, what if you go, what will people find out about my status? Or there's a protective element too of people saying, I don't want you to face discrimination and all these things. But our youth generally seem to be more ready to do it. So kind of navigating, supporting the needs of the family as a whole, and then also where the youth are at and where the parents are at, that's something we're dealing with. Yeah, so I think the stigma, of course, is there, but I do see it with the youth we see. They want to come out, and there's geographical barriers, and then there's some barriers within the family also. Yeah.
So maybe San and Ilhan, I could ask you, San, you talked about this, but maybe to build on it, is the stigma the same for everyone? And what does that mean for services? Do youth experience stigma in the same way? And what does it mean, say, to be a queer young person who's living with HIV? What's the stigma you experience there, as opposed to someone who is not queer? And yeah.
Yeah, I mean, and this builds on Ilhan's point around intersectionality yet again, right? And just sort of asking us to think about that, like, you know, again, and to Ashley's point about this is not just about HIV ever. It's never just about HIV. You know, thinking about those intersections of race and sexuality and all of these things when you enter, you know, a service. If it's only really catering to HIV and pretends that you don't come there as a racialized body, as a person with other, you know, positionalities along different axes of identity, you know, that can also come with that's its own form of stigma, right? To pretend that you're not, for example, working with a Black young person, or, you know, so really thinking about that for me. And for me, I'm going to pull on sort of the scholarship of Dr. Ronaldo Walcott, who talks about the fact that HIV, you know, when we think about the Black body, for example, the Black body has long been perceived as a diseased body. It just so happens that HIV happens to be the disease that we're dealing with right now, and talking about right now. But if you think about the Black body outside of HIV as a perpetually diseased body in the sort of white glare and white conception, then actually what we're talking about is anti-Black racism. And so whether that body happens to have HIV or doesn't have HIV, there's always an assumption about the Black body in terms of their sexuality, whether they're promiscuous, and usually that is the assumption, right? So queer, or, you know, for Black women, for example, there's this assumption of promiscuous, you know, behavior in terms of why they may contract HIV even. So when you think about that, when you really think about that, we're never ever really talking about AIDS phobia or stigma. You know, in isolation. What we're talking about is a larger script that informs what bodies are read as diseased versus what bodies aren't. And thus, if you're entering as a young person, or a young racialized person, a young Black person, entering a service that only is trying to cater to your HIV and completely erases the fact that you're a racialized person, that you're dealing with anti-Blackness in that space as well as outside of that space, that can, you know, these are the barriers in terms of whether or not a young person will, you know, go back and try to access that service. Or really sees themselves represented, you know, whether it's by the staff team or represented in even the mandate and sort of, you know, their engagement in that space. So really thinking about all of those layers for me are super important, because again, to Ashley's point, we're never just solely talking about HIV, and so really layering those things and you know, harping on you know, something that Ronaldo Walcott has mentioned, and I can't tell you you know, enough how many times and how many spaces I sit in where I have to bring that up, where I have to bring up, you know, even like, I mean, is it a surprise that the majority of the young people that we're dealing with are Black and Indigenous young people? Is that, but we never talk about race. We talk about criminalization, as if we're only criminalizing HIV, as if the people disproportionately being criminalized are not Black youth for a reason, right? That's contextualized by anti-Blackness in a particular way. We're not talking about those things. And for me, to constantly have to bring it into the conversation, it's, you know, I feel like I'm a broken record all the time, but yeah, but thinking about those intersections are super, super important. And also seeing, for me, it's also reflecting on, for any organization, what does your staff team look like? What is the cultural, responsibility of that organization to have representation, but not just to have representation, but to actually have that imbued throughout the culture of the organization in terms of the services that are being offered. So these are some of the things that, I can speak to. And also for me, it's thinking about, back to that point around gatekeeping, the way in which white-run organizations, and I've seen this time and time again, often gatekeep and sort of exclude, unfortunately, caring adults who are members of these very marginalized communities. So the number of, Black women that I know who've been caring for Black children, Black positive children for decades, including their own children, so not just their own children, in addition to their own children, but have been sort of pushed out of the sector, for example. And you have now white-run organizations where they can't, these women don't and cannot get employment, as a really keen example of this point, of how this sort of operates and how anti-Blackness even works and operates in the sector itself and through employment, and who's doing that emotional labor and who's getting paid for it versus who's not. So all of these things for me are really important questions and really important points of talking about what, stigma, but also in the context of a larger, structure and intersectionality.
Thank you. Ilhan, do you have anything you'd like to add to that?
That was so greatly put. I don't know what I could add to that. That was really great. I think one thing I could add as well is, as you mentioned earlier as well, that with HIV and the stigma and the discrimination, it already puts individuals living with HIV at the margins. But what it does when we look at intersectionality is looking at racialized individuals, racialized bodies, indigenous communities, and how that already pushes individuals who are already marginalized further into the margins. And from my own experiences working as a frontline youth worker for about 6 years, is seeing the differences in the public health paradigm versus the youth work paradigm, and how the language around HIV and what's happening. And I feel like from my own experience with working with youth, the stigma manifests differently based on the spaces that they're navigating. So certain youth workers that do have that anti-oppressive approach in that lens, creating a really safe and comfortable environment as it can get, you see a different way that the youth kind of present themselves. And looking at healthcare services where you would think individuals would think about the social determinants of health and the intersections of oppression, I think representation does matter, as you just mentioned earlier. And you do see, what I would see a lot of times from the youth is that they would get triggered and traumatized because of the history of healthcare systems and how that space in itself could be re-triggering and traumatic in itself, and further perpetuate stigma. Individuals who are supposed to be providing primary care and treatment as prevention to these individuals, but further continue to perpetuate that cycle of stigma. So, yeah.
That's great. Yeah. So it sounds like what you're saying is that the experience of stigma is itself layered.
Mm-hmm. Okay. Absolutely. And again, it's, for me, stigma is a simplification of what's going on, right? Like, I think it's much grander than that. And stigma, I think, again, yes, stigma inherently, for me anyways, and from the perspective of other scholars, when we're talking about it in the context of HIV, when we only talk about stigma, we're sort of stripping these very complex layers, and in itself, in that act, it's anti-Black in its very action.
Mm-hmm. Great. Dane, I think I saw your hand up. Dane?
There's so much truth, and maybe the time is limited in the conversation, the broader conversations that we're having today, and just branching out. But just understanding that, when we're doing this work, and especially I'm always going to talk about the outside of the metropolitan lens. So doing this work outside of Toronto and working with young people living with HIV in communities where they may consider themselves a bedroom community. We commute, so and the people that call it such are often the gatekeepers, the community gatekeepers. We go to work, so we commute into work, usually in Toronto. We come home, we shut the door. What's that saying for young people and for younger people, whether it's young people who are living with HIV or young people who just want to get the information and want to get the updated information, so they can make their own informed decisions. Ultimately, what we're doing is saying that, the decision, young person, is only contingent on what the elders or the adults are going to say, and that certainly cannot be the case, and it shouldn't be the case anymore. That's why, just here locally, like when we're doing the work, we often make very clear, and we're quite explicit, that it's young people working with young people, and it doesn't always have to be such a stringent, whether it's event or conversation where it's insert HIV here. We got to understand that as some panelists have mentioned, sometimes there's spaces required where it's just we just want to hang out and just heal, or we want to talk about TV show that happened, or a life event. Life events happen all the time, and they may not be something that someone else might be a big deal, but it's something that's important to bring to the table, and for someone to be willing to do so in spaces with young people where that trust and that community is being built. That's a really big deal, and we need to recognize that as young people working with young people. I'm look at me being the older person speaking on behalf of, but being able to have younger people working with you, so that peer piece to build together, that in of itself is so important to the strength and the thriving, not so much survival, but the thriving of the work and the deconstruction of the institution that's become the AIDS service organization. If we look at matters as more of a how you doing, how's things, what can we all do together so we can take care of each other together, instead of a checkbox theory. I think this sector going forward will do itself a great service by working with and listening to, but meaningfully listening to the voices of the young people coming up.
Mm-hmm.
Thank you. Okay, maybe before we move on to questions from our audience, I'll ask Ashley, what does a safe space feel like when you're a young person who's accessing services? What does it feel like? What does it look like to be in a safe space?
For us in particular, they're just like from like what everything I'm hearing and just like what Dane said, I think a really crucial part of being a part of like an HIV support group when you're young is just to know that you're being listened to, and for others to really take an effect that like how you're really feeling. Just because some go into the space not really wanting to talk, and so by pressuring them to talk, sometimes it doesn't always work. Or just asking them like what they need in order to feel safe, in order to actually like really get the most out of their experiences. Because like Dave said, like sometimes in our conversations we just want to talk about like the latest movie, or sometimes we do want to delve into really personal things and like how we're feeling. And I find that a thing that has really helped throughout like my entire life, and a lot of youth that I have worked with and that I have worked alongside and everything, that just like we like to talk about our experiences in order for other people to understand it. Because at the end of the day, the only people who truly understand our experiences are those in the room, those who have experienced something similar. It may not be exactly the same because like so many people mentioned, we all come from different walks of life. Some parents, they don't want their kids to talk about it, so they don't. As for me, I grew up, I was adopted, and so I didn't live with my birth mother who I contracted HIV from at birth. And so it's really different depending on who the person is, and just really asking about like, okay, what do you need in this moment? Do you want to talk about it? Do you want to maybe leave it for like the next time? Depends on like really where they're at, like community building and really creating a safe space, creating rules and things to abide by. Because like I said, like there are times when we want to talk about it, and just trying to get involved too. It's difficult for some, but just maybe giving the space or giving that little push, like it could make a world of difference. It just like depends on the youth. And so just making sure to know that they're always okay and that they're walking into a space that they're comfortable in. It's
like saying that there's no one size fits all.
Yeah, like I know everyone's there for the same reason to talk about it, but at the same time, you just have to make sure that like everyone is okay with it at the same time, because you don't want to make anyone feel uncomfortable about talking about a certain aspect, but making sure that like everyone is okay with it. And I think it like all depends on like what we're kind of looking for. So in every little thing that I've been to, like a conference or anything, there's always feedback and asking, what did you like about this? Is there anything you'd like to change? Any modules you'd want to fix? Things like that. Like asking for our feedback is really important in order to improve it for the next time. So I always find that like having that time to really community build and to really talk about whether it be anything in regards to HIV or just like anything we want to talk about is really important. Just having our voices heard and to feel validated, because some people, some youth, I know they go into the space not really feeling like they're part of a group, so making them feel as a part of it as possible.
Great. Thank you, Ashley. Okay, so we have a couple of questions from our audience. I will just throw them out to the panel and people will answer as they see fit. The first one we have is, what role can new scientific consensus such as U equals U, which is undetectable equals untransmittable, play in liberating youth living with HIV from both internal and external stigma? Should I repeat it?
I can try to respond.
Okay, yeah, go ahead, Sarah.
Well, I just think that that's a big question. And I think that obviously, like, you know, as you wrote in your report, health information is so important, and health literacy, and first of all, explaining what does U equals U actually mean, right? But then also finding a way that doesn't create different systems and different levels of people who are undetectable and people who aren't. Because when I hear that, I worry that then it could potentially divide youth into youth thinking, you know, we're the ones who are undetectable and you're not, and what does that mean? And just really understanding and all the intersectional elements that go into U equals U, that it's not just a given that someone takes medication and is, you know, undetectable, and all the other factors that influence maintaining an undetectable viral load. So I don't at all want to diminish it, but I also think that it's important to, when we're educating youth about U equals U, especially healthcare providers, it's done in a way that doesn't create this is the good result and this is the bad result and this is what it means about a person. So it's something I think there needs to be more work on, just because all the science, it's all quite new right now. And I know there are some people working on what does it really mean, but I as like a social worker and group facilitator would be very cautious with how I spoke about it, as to not alienate the people in the room.
Mm-hmm. I'll build on that. Oh, Dane's saying something.
We can't see.
What does U equal U mean for women, for Black and Indigenous women? Great questions. Those are great questions. I'll sort of build on some of that to just say, to totally agree that I think we need to proceed. I mean, these are really nice taglines. I'm always amazed at how fun and and light they seem. Like, you know what I mean? Like, they seem like, oh, that's a really great tagline.
Yeah.
But what does it actually mean? And that's what Dane's sort of trying to unpack here for us. And Samara, you sort of mentioned some really good points that we need to proceed with caution. Like, essentially for me is the big question, like, how, getting to a level of undetectable, what goes into that? What is a level of undetectable that we're looking for? The things that you have to sort of maintain, including a lifestyle, to be at an undetectable rate. And you're thinking about, again, folks that are impacted by HIV, just the layers of marginalization that might prohibit sort of teetering on approaching undetectable, and thinking about that in a really particular way. So I proceed with caution. I also think about, like, how much of this is putting the onus on HIV positive people to be solely responsible for HIV transmission. So how much of that are we doing? How does that reify and reaffirm AIDS phobia in a particular way, when we put entire responsibilities on the positive partner in this conversation? For me, I'm also thinking about, surveillance, right? Because ultimately someone has to, be regularly checked to basically demonstrate that they're undetectable. How much of this is about surveilling folks who are positive? So I think about all of these things. And when you think about that in the context of anti-Blackness and anti-Indigenous sentiments, that becomes a really scary place where, again, now we're surveilling over surveilling particular bodies yet again for a particular thing. So for me, these are all of the big questions that are raised with this really like catchy tagline that has really big implications.
Dana,
Can I answer that?
go ahead, Gana.
Sorry. I wanted to add to that. I was just showing Dane, like, I think the whole Youth with You movement kind of focuses on how positive people can, like, better themselves for other people and not themselves, like their own overall health. And just like that doesn't take into play all like social determinants of health. Like, do you have access to your meds? Like, do you have a place to sleep? Do you have some place to put your meds after you get them? Various things like that. So I feel like it's a very like high benchmark that just some people just can't obtain, and they shouldn't feel bad for that if they can't.
Thank you, Kiana. So it sounds like you're saying that we can't have the conversation about being undetectable without also talking about things like access to medication, access to supports that let you stay in care and treatment and such. Is that a fair summary?
Yeah.
Okay. Great. Yeah. Ilhan, Ashley, do y'all have anything to add or? No? Okay.
No.
All right. Okay. I'll go on to another question. Another question that we had submitted was, how are youth living with HIV involved in the research carried out about them and in evaluations of programs and of the research itself? How are they involved?
Well, I can kind of speak to that, being like a youth living with HIV. A big thing that like I've definitely I've been a part of a few different studies. And so that just means like every time I go to like the doctors, they take a little bit more blood than they usually would. And it's really nice too. I personally really like being a part of the studies because I'm essentially just not only helping myself, but helping other youth living with HIV and hoping to, your whole goal is to like find a cure and to find ways to help those living with HIV. And so the best way to do that, I find, is being a part of it as well. So like for me, I feel like I'm just being a part of the solution and just trying to help. And I find that like for me, just like the way all of my doctors have ever talked to me about it, they never make us do it, which is really nice. So they always ask me, like they making sure that we're giving our consent and that we actually want to do it and participate. And a lot of the time we get like a little honorarium for our service, which is nice and makes us feel validated and makes us feel like we're actually doing something in order to like help better ourselves and the others and like living with HIV.
Great, thank you, Ashley. Would anyone else like to respond to that question?
Yeah. So the question again, Sane, was,
how are youth living with HIV involved in the research carried out about them, both for the research and then evaluating the research that's done?
Right. I think this is a question that I definitely, in the last year especially, have really asked questions of. We had this, so Adrian Betts over at ACDR, along with Rami and Dane was more peripherally involved, but folks at the AIDS Committee of Durham Region organized this amazing youth summit. And of course the question comes up of research in that space, right, where young people are coming together to just be together, and that's really what they just want, this safe space to be together. And of course, the question that myself and my colleague Lena were probing at that time was, in this space where young people just want to be together, is that the space to be doing research? And especially when you've brought them to a place where it's like a camp, right? It's a summer camp vibe. Is that a place for research? And that was a big question and a big point of conversation and some contention, right? To be honest, in terms of that space. So these for me are really real questions. It's an ethical thing. It's an ethical and moral question as well. Like youth have said they want space to just be. Are we, in the right to then invoke our own interests and motivations in that space as researchers or clinicians or whoever. And very similarly, when I think about Ashley, so thanks so much for sort of like lending your own personal experience to that in terms of what it feels like to contribute to larger bodies of research that may benefit other folks in populations. But I also think about the moral thing, which is like, okay, so when you're asking for consent in a clinical space as a doctor, from the doctor's perspective, as a researcher, where's the ethical line where you've already got the client in the room? Yes, they're giving you consent in practice and in theory, they're writing down their consent, but in that space, you've built a relationship over time. This is your caring doctor. Is that how much of that is also about, sort of unspoken about coercion, right? Like you're not really speaking about how that relationship has been built over time. And so it's trusting, there's rapport. And so, really questioning all of those intricacies of, how much of that is actually consent when someone, is in a trusting clinical environment and space. Can they, where they're going for programming, where they might link their, programming and their clinical care to research in a way that it's not actually linked, because those are two very separate things. So for me, it's asking all of these very big questions, and increasingly so as I do some work with my research partner on research ethics, in particular around these questions, like, is it ethical to do research at, in a place, in a space where young people are isolated, where they're going to be amongst each other, or to be in a clinical space where they're getting healthcare. Is that ethical? These are all important, I think, questions that as individual researchers we need to ask, but actually, also as a sector, we need to be asking about what is ethical research practice? What is consent? What is full consent? In this space and place, when you're going for clinical care, are you making very, very clear to the patient, to the client, that your clinical care is not tied to research? Are we explaining that fully? Does the client understand? These are all of the things that, I think about, and it keeps me up at night in terms of just, doing research in a good way, like in a respectful way, the way in which you'd want research done if you were a client. These are all of the things that I think about, is how to do research in a good way.
Mm-hmm. Thank you. Ilhan?
Yeah, I was going to say I could add to that as well. This is a question I'm constantly critically reflecting on. And the one thing that I'm always thinking about is being conscious and critical of my own social location and what brings me to the research. Because this report was more so synthesizing literature that's already out there. For myself personally, when I was working on the research, it was really consulting with community organizations, staff that work with me at YouthREX that have a lot of resources and a lot of experience working with young people living with HIV in Ontario, and my own personal connections, thinking about my own friends who have either experienced substance use or can actually be the storytellers themselves, and really ensuring that I'm mindful of those experiences and that what I produce in itself will not contribute to further discrimination. That's the one thing I'm constantly thinking about. And not even that in itself, but how do I myself really integrate the three approaches I talked about in terms of anti-stigma, anti-oppressive approach, and thinking about intersectionality, and thinking about my own lived experiences as a woman of color and how I've had to navigate different resources and the intersections of oppression that I faced as well. One thing I learned through this experience producing this research is really being mindful of language. So for example, terminology that used to be used would be like youth at risk, and now it's more so vulnerable, marginalized youth. Instead of talking about these are youth that use drugs, it's more so youth that experience substance use. So really ensuring that I am validating the experiences of youth themselves and being mindful of the language that I use in my research. Also, because this was a large literature review, thinking about the references I'm using. So what is the credibility of these individuals? What brings them to that work? So doing a lot of research behind the people that I would be referring to myself and thinking about what kind of approach that they use. Are they taking a community participatory approach? And I think thinking about trying to bring in youth living with HIV into the conversation, I really want to be respectful of their disclosure status as well, and ensuring that I don't really push any youth to the margins and have them talk to me about their experiences when there is no trust. So these are things, as you were saying, about ethics and research, questions that we have to constantly ask ourselves. is what we produce, are we actually going to be supporting communities, or are we going to further push them into the margins by producing literature that could further exploit them or further discriminate them? Something I'm constantly grappling with, but that's the approaches I try to take.
Thank you, Han. Thank you.
And I think at the basis of what you're saying, Ilhan, is also just relationships. Like that is, Sean Wilson, who's an Indigenous scholar, writes about this, that relationships should be at the basis of research, right? Relationships to, like you were saying, like knowing, the motives that bring certain authors and scholars to the scholarship that you're reading and citing, relationships with your participants, building relationships between participants, like all of these things are super, like that Sean Wilson highlights a lot of these things. And so just sort of name dropping, because I think that his scholarship is also really dope.
Thank you.
For me, like speaking on that, like having that relationship, as you said, like for every youth, it varies and it's different. But for me, I feel so comfortable being a part of the research because usually my nurse that I do these research things with, and that the ones that do take my blood and ask for my consent for these research purposes, I've known them for almost 21 years. And so it has been like a process of like building that relationship, building that rapport, and being comfortable enough to want to do that. So I find, like you said, like relationships are at like the core of the research and how it gets done, and implementing and involving youth into them.
And I would just say one piece around sharing the research then, because we hear a lot from people, okay, we were part of the research, we never saw the results, or we never read the report. That's a larger research question also. So, that piece. And then also, I think it's important to be mindful of who you're asking to participate in the research, because the population of youth living with HIV, right, in Ontario isn't that big, right? And then you consider all the people, and then not everyone wants to be involved. But so then how many times, some people are open to it, but some people are like, how many times can you ask me to be a part of this? And so kind of balancing getting feedback and getting people involved in the research process, but also you don't want to feel like you're exploiting people. So.
Great. Okay, well, thank you so much. We're just wrapping up the webinar. We have one final question for all the panelists. So, and that question is, what is the most useful thing you would tell a youth worker? What is the most important takeaway that you would give them to think about in their practice? So maybe we'll start with Kiana and Dane, if you can give us what your one takeaway is and go from there.
I'm going to start. That things are always changing, and don't assume you know anything literally ever, because they're always changing, and always making sure to check in with the people you're serving. If it's the thing you thought they really needed before still relevant, is there something else? So that would be my advice, is always check in with the people you're serving.
Thank you.
I guess for what's the most useful takeaway for a youth worker?
Yeah.
Understand that I statements go a very long way. Again, young people working with young people, or at least that should be the goal. It's a peer environment, it's a community-based environment, and the perspectives are quite often going to be coming from the I. So being able, willing, and flexible enough to understand that the I is going to often be there and be present. That would be the biggest thing that I would offer for someone to take away.
Thank you. Ashley, what would your takeaway be?
Would you mind repeating the question again?
The question is, what's the most useful thing you would tell a youth worker? What's the most important takeaway?
I'd say in terms with working with the youth, just constantly checking in on them and asking how they are, making sure that they're comfortable with everything. Because in order to create like the safe space, you need to make sure that everyone who's present like wants to be there and they want to be involved. It's just really catering to the needs of every HIV positive youth that walks into the door, because it is very personalized. It's very different. So make sure that you're on like this good grounds and like using the right language when you speak to somebody, because like every youth is different. What I've experienced and what others have experienced is completely different. Just knowing that we're all living with HIV, it's just really being careful with each individual, I'd say, is like the most important thing.
Thank you. Sian.
I would say, sort of echoing a lot of what's already been said, actually. Kiana mentioned and Ashley mentioned sort of, catering to the young people and what their needs are, and also for me, it's also about being honest of what you can do and what you can't do. So having honest conversations with young people. I think often, as programmers or whatever authority space that we hold, we often think that young people are fragile and we can't be honest and have real conversations. These young people are organizing themselves, making space for themselves. They don't need us. They're wise and intelligent beyond their years. So being real with them about what's feasible, what's doable, centering their voices and their perspectives in terms of what you're doing in terms of the program you're developing, for example, and also to Kiana's point, knowing when you don't know and being okay with not knowing, and also being honest about that. I think honesty and authenticity goes a long way.
Thank you. Samara?
I mean, I'll keep echoing, but I would also just say trying to facilitate like as many opportunities for people for peer support. I mean, so as a youth worker, just trying to figure out ways that can bring people together on their own terms.
Thank you. Ilhan.
Again, I'm going to echo what everyone says because it was all fantastic. But really being reflexive and critical of your role as a youth worker and thinking about how you could use a strength-based approach to really center the narrative of the individual. And I think a lot of times when we read certain research, we think about it from a population and like, this is going to work for everybody. But thinking about how you can pick out central core components of research and think about how can you allow the individual themselves to navigate and support them in navigating that. So again, centering their experiences.
Thank you. All right. Well, thank you so much, everyone. Thank you, Ashley, Samara, Ilhan, Sian, Dane, Kiana. Thank you all very much for participating. That brings us to the end of our webinar. I will remind everyone the report, as well as associated fact sheets and supporting documents, are available for download at www.exchange.youthrex.com. That is our knowledge repository or our library of resources. So you'll be able to find the report there, as well as other resources. If you're someone who's working with youth, we have a range of resources there covering different topics. So please do download them. We also have added all the bios for our speakers to the website handout, so you can find out a little bit more about what they do. I know that we really didn't cover how fantastic this panel is, but I would recommend that you all look them up because they're all doing really incredible work here in Ontario. Thank you again, everyone, for participating, and have a good day.
Thank you.
Thank you. Bye.
Bye.